We are recording this event, so just so feel free to have your videos on if you would like, but just know that this is going to be a recorded event. I will give just like 2 minutes for some additional people, or a minute or so, to come on in, and then we're going to get started with things, okay? Alrighty, everyone. I'm going to go ahead and get started here because I anticipate that we may run out of time if the conversation is going great, which I anticipate that it is going to go great. So thank you very, very much for joining us here for this discussion on Spanish inclusivity in veterinary medicine. This is something that we wanted to do for Hispanic Heritage Month, but it didn't work out as planned. So now we're here, and we are so happy to be doing this today. So I thank my panelists for joining and being able to be involved in this discussion. And really the purpose is to just have an organic conversation and just really bring exposure to what it's like to be someone who is bilingual in our field, and the importance of introducing non-native speakers into learning about or learning Spanish rather, and introducing that like from the beginning in veterinary school. So I will go ahead and introduce myself, and then I will flip through some bios. From there, we're going to start sort of a conversation. I have some questions that I'll propose to the panelists. And then at the end, if we have time, we'll go ahead and go into some questions and things like that. But if you have questions throughout the conversation, please feel free to put it in the chat, and I'll be monitoring that periodically. So first, my name is Genesis Felice Jones. And my pronouns are she, her, ella. And I graduated from St. George's University in May 2021. I am currently practicing in Raleigh, North Carolina. And I actually see quite a lot of Spanish-speaking clients in my area, which was kind of a shock to me. I don't really know why, but it was shocking. And there was a time in which I thought I forgot my Spanish, and I kind of had to refer back to, just like calling my mom and asking her some questions and like, Ma, how do you say this? And granted, she has never said medical terminology. And so she was like, I don't know. So it was quite the struggle in the beginning, but I am so happy to be able to cater to our Spanish clientele, and it's awesome. I'm going to flip to Eddie. I think I saw you on the call, so go ahead if you're ready.
Hola everyone, my name is Eddie Rios Guzman. My pronouns are he, him, his, él. I am third-year veterinary student here at Cornell University. My interests lie in the realm of aquatics. That is what I want to do. I'm an aquatic veterinarian, specifically with aquarium medicine and conservation medicine of that. Yeah, I'm here to represent the student side. I'm pretty sure there may be other students here to talk a little bit about what we've been doing at Cornell and what we've been trying to do with regards to teaching Spanish. So I'm really excited to hear all your perspectives, and I'm really happy to be here.
Hi, everybody. My name is Melody Martinez. I'm a certified veterinary technician. My pronouns are she, her, and ella. My parents come from the Dominican Republic. I grew up in Massachusetts and currently based in Portland, Oregon. I've been a veterinary technician since 2007, and I've worked in small animal emergency and critical care and as an animal caregiver at Farm Sanctuary, which is this country's largest rescued sanctuary for farmed animals in New York. In 2015, I left the clinical setting. I was working in the ER. I was a little burnt out and left the clinical setting and actually started working for racial justice and social justice organizations in the nonprofit sector. And also started my own consulting business around diversity, equity, and inclusion, which is what I do now. I still relief as a technician on occasion and do a lot of volunteering, particularly with people experiencing homelessness with their animals. It's a passion of mine to support that community in particular when it comes to veterinary medicine. And I am the president of the Multicultural Veterinary Medical Association. And we are so glad that you're all here. Thanks for joining us.
Hi, everybody. I'm Mandala Hunter Ishikawa, and I'm here with my partner, Peter. And we are here from Colombia, so we're living the Spanish life. I am a veterinarian. I graduated from Colorado State University like ages ago. And I worked in small animal and mixed animal and with wildlife, with bears in Asia and lions in Africa. And now I'm doing my day job. I work for an NGO as well, teaching animal welfare to veterinarians in China. But the reason why we're here is that we actually have a business teaching Spanish to veterinary professionals. So we can talk more about that during our time. And so I'm the content provider as the veterinarian with all the clinical experience, and my partner Peter is the professor. So go ahead.
Hola.
Peter.
Take it from there. Hello, my name is Peter, born in the States, born in Miami, Florida. I went to University of Miami. I've been a teacher for the last 20 years. And mostly a teacher trainer. While she creates she gives me all the content, and then I make it into hopefully interactive type of experience online where I train the teachers that we have a full-on staff, and very happy to be part of the animal world. You guys are amazing people. So I would say that she deals with the animals and I deal with the humans. So
That's true.
It works nicely. Yeah, we've been doing this for the last like 2 years now. It was our pandemic baby, and really happy to be here with amazing people.
All right, excellent. Thank you guys so much for all your intros. Let's go ahead and get into some questions. I mean, so everyone's, our panelists here, we're all different backgrounds, right? All have different positions. So let's start, I guess, from where this might be the most important in terms of where do we introduce Spanish. So I'll phrase this question for everyone, and whoever please step in, but why is it important for veterinary colleges to offer a Spanish language course?
I'm currently in vet school, so I think I'll start. So yeah, I think it's super important because it's inevitable that anyone who is studying veterinary medicine will at some point in time interact with a Spanish-speaking person, specifically a Spanish-speaking client. And I feel like even if it's at a very, very basic level, we should be able to communicate with our client in order to provide the best care for the patient, which is at the end of the day our main purpose. So I feel like veterinary curricula should move towards teaching Spanish. I think even if it's not possible for the College of Veterinary Medicine in whatever state to host a Spanish course, they should at least allow students to be able to take courses of the undergrad school they may be associated with. And that could be Spanish, that could be any language, but in this specific context, it should be Spanish. And yeah, and also the programs, the Spanish for Vet Pros, I think that's really important, and they are really important stakeholders in actually helping veterinary curricula develop the Spanish courses that we might need. Here at the vet school, I can only speak for what we do here. And I failed to mention that I'm the current Latinx Veterinary Medical Association president here at Cornell. We basically made our own little Spanish course. And we just gathered Spanish speaking TAs, students, and used the book, Spanish for the base introduction to Spanish for veterinarians, or something along those lines, a little blue book. And we just, as a group, went through it together to try to teach our students Spanish, because quite frankly, the administration is not budging on making a Spanish course. So we just took it into our own hands, but I don't think that should be our responsibility. I think it should be administration. It should definitely come from the top down. So yeah, going back to the original question, yes, I believe it's super important, especially because we're going to interact with Spanish-speaking clientele, and the best way to provide care for our patients is just to know the language, even if mildly, of whoever we're attending.
If I may, really quick too, demographics alone, just the numbers. That's the largest minority in the States now is now a Latin American. And from Mexican all the way down to Argentina, we got people from all over the place. And it's always, you have to deal with, as the vets, it's usually like the sobrina, or the niece, or the granddaughter who translate for you, and they never get it 100% correct. So you're speaking through a translator. It's always kind of tricky. But demographics alone, just the number of Spanish speakers, there it goes.
Yeah, I would say we're the second highest population in the world, in the United States, of Spanish speakers, behind Mexico. So it's like 41 million speakers in the United States to date. That's just the chances of interacting with a person who speaks Spanish, or who only speaks Spanish, or primarily Spanish, are really, really high, all over the country. And we know that there are hubs in certain states, in certain cities, where Spanish is the primary language spoken in many of the businesses there. It's the fastest growing language in the US. I think like something between like over 200% increase in the last like 3 decades of Spanish speakers in the US. And so, and that number is just going to keep growing. We know that, you know, the increase of people who are coming to this country and people who speak Spanish in the United States is growing year to year, with that projected probably to, if not double or triple by 2030, which is really not that far away. So I think it's really important in vet schools. I also think it's really important in technician schools and technician programs that we have courses. I mean, you know, we have to take courses on medical terminology in a lot of health professions, right? Just to understand, you know, the root of a word, right? And what that tells us about a condition, for example. I think it's important to have medical terminology courses in basic medical Spanish. That should be at the very minimum a 1 semester course where people are learning medical Spanish, functional medical Spanish. You don't have to be an expert, but it's functional. You can take a history. You can converse about finances with a client. You can help them understand their pet's condition. And since veterinary technicians and assistants are the ones who interact mostly first with a client, I think it's really important that we not stop at veterinary schools, and we expect our technician programs to also have that as a standard.
Yeah, Melody, that's an incredible call out. Actually, I've never, thought of it in that regard, and that's so true. That's so true.
I can say that because we've been doing our program for the past 2 or 3 years, and there are people from all over the US. Like we had professionals taking our class from South Dakota, and I'm like, are there Spanish speakers? And like, I didn't know at all. Of course, California, Oregon, Texas, that's in Florida, but yeah, Michigan, name it, and people have reached out from those places. So definitely, there's definitely a need. And then as far as vet students, we also get emails from individual vet students as well as vet schools. So there are definitely schools that are very willing and wanting to have some kind of program incorporated into their curriculum, whether it's funding related that they can't quite jump on it. But we definitely have vet schools that will fund like a short course for their students. So it's happening. Like I think people are realizing it, and hopefully we can provide some good, maybe even if it's just like an introduction course or something, just to get some little bit of vocabulary for the students to start.
What do you think, really quick? Also, money. The clinic that speaks more Spanish gets more Spanish-speaking clients. So it just, oh, ellos hablan español. I want to go over there rather than I have to take my niece, whatever.
Yeah, very true. I just wanted to call out here what Felix is saying in the chat. And, you know, what was said is that it provides a role model for Spanish-speaking children who come in, which is a huge advantage. And that's very true, because for myself, for example, when I have, you know, a client who brings in their children and they're kind of like looking over my shoulder as I'm doing things, you know, I kind of involve them in the exam too. And imagine how that dynamic would work with the same scenario with, you know, those Spanish speaking clients coming in too. Then you have that component, that population also interested in veterinary medicine too, which for me, for example, when I was growing up and I was a kid, I did not see any, you know, Latina speaking veterinarians with my dog and stuff. So yeah, very good point.
Well, and you know, just soy mexicano, nacido en Mexico, pero criado aquí en Los Ángeles. And you know, the two highlights of my career when I went back, I finished at Penn and I went back to practice in East LA, was on two occasions. You know, it was a mother and a child. Mira, es mexicano y habla español. Tú puedes ser doctor, ándale a estudiar, right? Twice. I got to hear that twice. And it was just kind of like, yeah, baby, this is what I came back for. And it was that kind of putting yourself there to be the role model without realizing you were going to do it. You know, and again, that whole interaction with the parent, the interaction with the child, then you ended up with, you know, those two brownie points that I still remember to this day.
Yeah, we have it loud and clear. Representation matters.
Huge.
Yes.
I want to add a little bit on this question too. I think compliance as well. When you're dealing with a client who does not understand, who can't understand what the doctor's saying or what the technician is saying, what's the likelihood that they are really going to understand what you're trying to communicate about care for that patient, right? So if we can't do basic communication in a language that's preferred by the client, I'm sure that compliance on any of those treatments that we're suggesting are going to dip. And so I think it's just so important. Like, we want that patient to be taken care of really well. We need to be able to communicate clearly with the client in a language that they understand, and that allows them to do the best that they can for their animal.
Any last comments on this question?
I just wanted to comment on a comment that was made in the chat. And I'm sorry if I don't know if you all can see that my camera is like being weird. I don't know if it's just on my end, but I apologize for that. I'll try not to be distracting and turn it off when I'm not talking. But yeah, someone commented and Melody responded about large animal vets. And I feel like that's so important. Like, if you go into large animal, you will, like, 100% guaranteed interact with someone who speaks just Spanish. And here at Cornell, we have like a farm worker program. We did like a talk once about farm workers and their challenges. And I remember quite clearly someone whose family owns a dairy. She immediately called her parents and was like, hey, this is what I learned from this talk. And this is why it's important to like put a poster in Spanish about certain things that you should expect your workers to do, but assume that they know how to do without having actually spoken with them. So I feel like it's super important. If you go into large animal, you must know at least the very basics of Spanish so you can communicate with the handlers who are quite frankly the ones that are with the animal at all times and actually know the animal that's going to be treated. So thank you for whoever who made that comment. That was great. Thanks.
Excellent. So I think this kind of goes off of what we've already been talking about, but how can veterinary practices then, or what can they do to be more inclusive of their Spanish-speaking pet parents then?
Yeah, I think from my perspective, and again, probably the oldest one here in the group, but when I started in '85, there were very few handouts that were in Spanish. So we used to translate our own and we'd give them the translation of it. But it really does come down now. There's a lot of stuff, both from AHA and from AVME, and making sure you have that and making sure you give that to people. And then, not assuming that everybody's going to have the same literacy, kind of talk them through it so that they can say, te voy a dar este folleto, and, this is what it says here, so that you kind of get in there. And it really is, as more and more resources become available, to just make sure that you have them and you use them, para que no les dé pena pedirlo en español, go ahead and give it to them in advance, right?
And I think that obviously we provide live classes for vet professionals to practice, client communication. So our business we don't do necessarily like grammar conjugation unless it's necessary. It's all like, we don't want to waste anybody's time. And it's just like, we don't need to know all the conjugations of, correr, for example, but we really focus on that client communication. And I think it's useful, all the feedback we've gotten from people who do work in the clinics, they even bring their cases and said, oh, somebody came in today and I was able to go through the wellness exam in Spanish, and they were so proud of themselves. And especially a lot more since we've become RACE certified and we give credits, like a lot of clinics are paying for their staff to take these classes. And we provide discounts for LVMA members and students as well. But yeah, we're seeing a lot more people, like even they might have paid for their own, the first module, but then the clinic will jump in and pay for the next ones because they've seen their staff become more fluent and more able to serve their clients. So.
That's a main idea, is that just trying is better than not. They're like, okay, mi español es terrible, but as long as you try, it's much more appreciated than not. So I guess it was one of the things to be more inclusive is just even trying with a little bit of Spanish you have. And Google Translate the rest.
I know we're all like type A perfectionists. And I had to remind somebody today, like, look how far you've come, and you don't have to have perfect verb tenses. Like, you are sitting here communicating in Spanish about the animals' illnesses and finances and all that stuff. So like, yeah, like Peter said, as the teacher, it doesn't have to be perfect. We just have to communicate. And as much as, we give patience to people who don't speak English very well, like they will also give us patience for not being able to speak Spanish very well. And I'm a Spanish learner, so I know that for sure that it happens.
I think additionally, hiring for the skill, we tend to put our job descriptions out there, and it's, I rarely see in veterinary job descriptions, Spanish speaking, Spanish language preferred, or it as one of the qualifications of who they're hiring, really wanting to look for Spanish speakers in the community. And also identifying if there are Spanish speakers in your practice already, and then paying them for it if that is something that they want to do. Because not everyone who speaks Spanish wants to be utilized in that way in the clinic. I think about the front desk staff who are like, I'm not a tech, I'm not an assistant, I don't want to be pulled out of, from the front desk to go to the back and start to explain something that I don't have a lot of knowledge about. So if you're gonna ask people to do that in your clinic or in your practice, pay them for it, pay a differential for it, because that is a skill. And if it's a skill that you need, and a skill that you'll be profiting from, then you should pay your staff for speaking that skill. Additionally, I think it's, like other folks, like providing money for CE in medical Spanish, like invest in your team learning, your technician staff, your veterinarians, your front desk staff, everyone really, frankly, learning Spanish for the course of their work. I think that's especially important if you know that you are in a community that is likely to interact with Spanish speaking clients. So it's really important to also like understand the community that you're in, and ensure that you're providing that to the community, and also understand the nuances of the community that you're in. I think someone in the chat said, about the different identities, Latinx, Hispanic, nationality versus ethnicity. Part of that is understanding the different dialects, right? So if you've got a lot of Puerto Ricans in your community, the Spanish you speak probably shouldn't be of a dialect that originates in Mexico, right? It may not be able to be translated, right? And so paying attention to like what community you're in and what your community needs are. And I think also, again, just like whatever resources that whatever resources that you use, your client education handouts, like what LVMA has, like you paying for the creation of those, right? Or creating them yourselves. If you heavily use this flyer or this one pager on heartworm disease, then you should have that in Spanish. I also think that, we don't do well enough in this profession to push vendors to provide literature in Spanish. Like I shouldn't have to explain health insurance or pet insurance in Spanish. It'd be great if Trupanion could just give me a Spanish flyer for their product, right? Or if any of NextGuard could give me a Spanish brochure for their product, right? That explains why their pet needs this product. So I think that we could be speaking to the reps who come in and pushing for this literature that we offer in our clinics in Spanish. And the more they hear that, hopefully the more they actually they pay to have those things produced and ask us, hey, do you want literature in these languages? We have all these different languages. And yeah, investing, like when all else fails, human medicine has this down, right? They invest in telephone-based translation services, so that your front desk staff can pick up the phone, or you can call a number and get someone on the phone to help translate whatever you need in Spanish. So I don't know, I think a lot of those things, like there's value in being like, let me just pull out my Google Translator. But like to really show an investment, I think that our practice owners, our clinics, veterinarians, like we need to go further and really, really invest in the staff and invest in the community. And that's going to take doing more than pulling out your phone and using Google Translate.
Yeah, Melody, you really nailed it there with everything that you said. Just going off of that, I think one of my biggest regrets when I was first looking for a job right after vet school was really not advocating for myself and realizing that speaking Spanish was a skill. And I kind of just put it on my resume, but I didn't really like advertise that I was bilingual. And my thought process was like, oh, well, I don't know if Raleigh, North Carolina has that big of a, Latino community and everything. Well, I was wrong. And it really stretched myself like in my first year, because I was the only Spanish speaking veterinarian or person in the hospital. And so I'm having to take on appointments from the other doctors because they cannot communicate with them. And so I have more appointments because, they're on the schedule and we gotta be able to see their pet at some point. And so it was tough. And there becomes a point in which you say, hey, I need to be compensated more for this because I am doing more than what I said I was going to do, And so that's definitely something that any fourth year student, whatever it is, that's something you are bilingual, make sure that you let it be known that that is a skill and know your worth when it comes to that. So that's what I will say about that. But I will also point out that I pulled up this LVMA tab here just as a resource for everyone to be able to have on our website for client education. Oh, you know, we have a lot of handouts from the AVMA and things like that. So here are some materials that you can use for CE for those clients who do speak Spanish. Does anyone else have anything to add on this topic? All right, I'm gonna go to, I think there was a question in the chat that I wanted to bring up here. So Dr. Guten, who is a previous professor of mine, she wrote in to say, I'm curious what the panelists think about educating all vet students about the complex identity of Latinx versus Hispanic, and nationality versus ethnicity versus race. I think it is important context, but what do you all think? Do we go there in vet school, and how deep in do we go?
We're like, ooh, if I may, because it is my actual course study. I'm a sociologist and a teacher by training, but it is a really difficult concept in general. And it's like, how deep do you go when you have to learn about excoriation and veins and stuff? Whereas this is like another field entirely. In an ideal world, you would get as much training as humanly possible for dealing with the humans. But we don't live in an ideal world, and your core studies are already insane with chemistry and all of that nerdy stuff. So on the other side, the sociological stuff is maybe a little easier to pick up a book and like read up on more, but it's so difficult to go through the nuances of all of the difference, just the definitions that they had in the chat alone, and the different like subcultures within each culture, because even just Puerto Ricans, depending on what side of the island you're from, it's a little different, and like how you perceive things is different. Your natural, the natural world and your position in society and all of the different little nuances again of culture is really, really tricky. So I would love it, and I guess everyone would too, if you had some kind of training in that during vet school. But time and money, another thing, how much you pay already for vet school is crazy. So yes, I mean, I think all of us would say, yes, absolutely. It would be something that we all need. But in the real world, it is a little tricky to do. So if it's something that, just to like self-promote too, it is something that we plug in into our course as well, is we ask, what is the demographic of wherever you are working, like in North Carolina and Raleigh, random, where are they from? Like they're Nicaraguan or Mexican, you never know, or like Colombian or Argentinian, it would be a little different. So we would do our own research too and ask vets within the country, what kind of little different thing would it be when communicating with a client? And we've gotten a good like a resource base to work off of. So really, really tricky and great question. And a lot of these are just amazing questions. But see, it's really, really difficult. And that's the answer right there. Like we wish we could, but how do you do so? And it's an entire other degree that we're talking about.
Okay. So if I may, I'll give you two. Sorry, you want to go, Melody?
Sorry, I just want to make sure that we have time for the panelists to speak.
Oh, go for it.
So while I agree with Professor Peets, like it's a really complicated and nuanced questions, I think that one of the important things about this question, the way it was posed about, educating all vet students, I don't think that this is necessarily, the way I read this question, I didn't think necessarily like, oh, it's so important just for everybody to know these things because it's going to help them do their work better. I also think it's important for internally in the workplace when you interact with Spanish speaking or Latin American, Hispanic, Latinx people in the workplace who are your colleagues, right? So for me, as a Afro-Latina who from Dominican descent, right, who's Dominican, I often get in different places wherever I live. Where did you learn Spanish? And I'm like, in the womb. and that's just a shock, right? Like it's my first language and people are like, oh my God, really? Because they don't expect someone who looks like me, and they certainly wouldn't expect someone with darker skin than me to speak Spanish. And yet Black people make up a large contingent of a lot of Spanish speaking countries, right? And so I think it's really important on the education level in veterinary schools when it comes to, and vet tech schools, which don't do a lot of this, right? Thinking about educating around diversity, equity, and inclusion, around microaggressions, around implicit bias, right? Not just for the benefit of the client, but for the benefit of your coworkers, right? So ensuring that you are understanding the nuances, even if it's at the most basic level, that not everyone who speaks Spanish is from X country, right? Or has X cultural beliefs, right? Or celebrates Z holidays, right? Like it's really important, it's just like, I've had people be like, oh, what are you doing for Cinco de Mayo? And I was like, well, first of all, I'm not Mexican. And even if I was, I wouldn't necessarily celebrate that holiday, right? So like, it's really important, I think, for building more inclusive practices, more inclusive profession, to do have a little bit of that sociology background, a little bit of that in ways, educating students in ways that they might interact with that in the veterinary profession. We are a profession that serves the public. We are a profession that employs a lot of different people, right? So I don't think that we can isolate ourselves from like the social constructs of the world, right? Race, ethnicity, all gender, disability, all of these things. So I think it's important for all of us as people, but especially as people providing a public service, right? A medical service, to become more educated about those things so that we can ensure that our practices are more inclusive, that they are not unintentionally creating harm.
And I feel like all of that, I just want to piggyback off that because that was amazing. Thanks. But I think this is where cultural humility may start to become a really relevant term. Just knowing that you will never understand everyone to really understand your own culture. I feel like that's such a simple thing to get up here, and it's something that even before we start vet school and during orientation, I think here at Cornell we try to incorporate some of those very basic skills that just allow you to be respectful of people around you. And I feel like there are ways to maneuver around the curriculum to be able to integrate these things in there. And I think more so, not so much a maneuver, I think it's something that has to be implemented because we are a people profession, even if we do deal with animals. And you can't just practice medicine without interacting with a person. So you have to know how to interact with them. And even more so than, benefiting the client, benefiting our coworkers, is benefiting yourself. Just give that gift to yourself about knowing other people, being able to respect other people based on their differences and appreciating differences. I think that's something that everyone should be able to do. And if you're not actively reflecting on how you can be better about yourself and how to treat others, then that's something.
What are your guys' thoughts on how can we encourage, our colleagues, our coworkers, others to, I guess, gain interest or get them excited about, I guess, jumping on board with learning at least a little bit of Spanish, and we're not talking about being fluent, right? We're just talking about being able to at least hold a conversation with a client. Because I've had multiple people walk in through our clinic doors who are Spanish speaking only, and no one can communicate with them. And they're like, you might have to come back in when Dr. Jones is in, so that then you can let us know what you are asking, I guess. So I'm just wondering, how can we encourage?
I can speak for the student side. Honestly, I think a lot of us are really interested in learning Spanish. Like here, we got a lot of, when you sent out the interest form from this little Spanish thing that we put together, we got like 80 or 90 people. That's right off the bat. Because I feel like there's a really, really big interest in learning the language, especially for students, and maybe different for professionals that are out there because y'all are, I mean, we're busy, but y'all are super busy. So it might be hard to make the time for that. But here, at least, I think there's an innate interest in that. And whenever I try to promote an activity or we try to do anything related to Spanish, we also try to provide a gift in return. It shouldn't be that way. We want people to innately want to do it just because, but usually we try to provide a credit or some experience along with just learning Spanish, and then we can get people motivated into, even more motivated into learning a language because you're getting a little bit of something back, if that makes any sense. And I feel like that could be rates like CE credits, or that could be putting it on your resume so you're more likely to get a job. So things that promote professional, like professional development in veterinary professionals it is a way that I can think of motivating people to get a little bit more interested. One of the biggest problems we have here is that sometimes there's a lot of like DEI initiatives and DEI work that tries to be done, but the people that need to be there, the people that are not DEI, are usually the ones that don't show up. Usually it's people that already have some skills that are trying to build more competence. But it's always really challenging to find a way to rope in people who need this, who need the workshop to actually be there, because, and that's why we have to resort to like giving credits and doing like giving something that so they can be participating in whatever we know.
Cool. That's a good idea. In the professional world, we provide certificates. So that's always like a, ooh, yay. But maybe on a more personal level is just to actually speak Spanish to people. Be like, hola, buenos dias. They're like, oh, what does that mean? And then it becomes like you're part of this new club that speaks another language, just totally just directly with them. Oh, gracias. What does that mean? And you start picking up the little things, and it just like, come be part of our club, be bilingual. We're awesome. Okay, that was really quick. Melody, back to you.
I think it's important. You know, I struggle with this question about like how to encourage staff to speak more Spanish. I think that if you have power in your clinic, in your practice, and you have information that your clientele primarily speaks Spanish, or that you have at least some subset of your clientele that primarily speaks Spanish, I think encouraging non-Spanish speaking staff is the hardest way to get around this issue. And I would say, you know, as a consultant, I would say you need to start hiring Spanish speakers. And I'm sure that there are people in your community here who do speak Spanish already and have a veterinary background. And if they're not, at the front desk level, at the assistant level, right, at these non-credentialed levels, what would it look like to go into the communities that speak Spanish, to you know, look for new hires from communities that speak Spanish, from people who speak Spanish, right? So building relationships with Spanish speaking community is really important. If your city or your town has community events where Spanish speakers are likely to be present, right? Like tabling at those events, letting them know that your clinic, you know, wants to see, you know, pets, animals from the Spanish speaking community, and that you have resources available to support them taking care of their pets. If there's a social service agency in your city or in your community that primarily serves predominantly Spanish speakers or immigrants, right? Going to that social service agency and telling those social workers, hey, my clinic, we have some Spanish speakers, or we have resources in Spanish. We really want to, you know, be a resource to the Spanish speaking community in our neighborhood, in our town. Please, can you give these flyers out when you have people coming in here for other resources, right? So like being a part of the community, building relationships with the community. Those places might know of early college students or high school students who are looking for receptionist work, or who are looking for veterinary assisting work, right? So I think it's important to not take the hardest route, which is trying to make non-Spanish speakers into Spanish speakers. However, if you are going to do that, I think that needs to be normalized from the top, right? I like it when I go into a place and I have to fill out a form, and this is important for, you know, when someone's filling out a form about their pet or their cat, or they're a new client to your clinic, asking what languages they speak. at home? What is your predominant language, right? Gathering that data can help you understand, hey, the people who are coming into our clinic, a lot of them are Spanish speakers. We have data on this. So we're gonna spend 15 minutes at every staff meeting learning some new medical terminology for Spanish. We're gonna do this together as a team so that we can better serve our clients, right? So I think it has to be a little bit more systemic, and a little less like, hey, let's speak Spanish together. But like, that's important. I think it's important to make it fun because no one wants to have this be a burden. But like, in addition to changing school curriculum and pushing vendors to have materials in Spanish and creating our own materials in Spanish, really doing that from the top down that Eddie was talking about earlier, like who has the power to kind of change the culture of the workplace and the expectations that we have, and how do we build more relationships with Spanish speaking communities?
Yeah, just going off of that, I think a lot about how I've had coworkers in the past say, I've taken Spanish and I know a bit of it, but they feel uncomfortable, like even using that little bit of Spanish, like they're embarrassed, And so with that aspect, I find that my kind of role is to encourage that. It's like, okay, well, hey, why don't me and you have a conversation in Spanish every now and then so that you can, start to build it up again. But I find that a lot of Spanish speaking clients, even myself, sometimes when I'm just having a day and no words are coming out and I'm like, trying to find that one word and I can't find it. Like the client who speaks Spanish is like trying to help me out saying different words, and then eventually we get there. And so I feel like those clients, they are just appreciative that even any sort of communication is going on, because there are so many instances where I run into, those clients that have never even been able to communicate with a veterinarian because no one has even ever tried. So I think it's so important. It doesn't matter how little you can speak or how much you understand. I think that just even having that start is really valuable. If anyone has a comment, otherwise, go ahead.
Oh, I was just going to say, since I've worked in many different places, I have tried to learn Mandarin, and it's very, very hard, and not everybody is as accommodating for beginners. But definitely, I would say learning Spanish and living in a Spanish-speaking country, like they're so accommodating, and they look at me like, oh, like bless your heart, you're trying. And so definitely, if you're a beginner or you're shy about saying something wrong, or don't be, because I feel like, I don't want to generalize, but in my experience, everyone's been so nice. And also, I think that I would say like most of the students who take our course aren't Spanish speakers or from like a Spanish speaking background. And so they are like, there's definitely like us type A people who are afraid to talk and stuff, but like we purposely hire teachers who are extremely welcoming. Like being a learner in different languages myself, like, yeah, you're hard on yourself and you can't remember anything, but if you have someone on your team who's like, just try to roll those R's and try it, say diarrhea. And you know how many times our teachers roll the R's together, let's do it together. So it's okay. Like, don't be so hard on yourselves, try a little bit more. And I think if you're having fun with it, or if like, people who want to keep trying, like make it fun and say, hey, let's join this course, or, that kind of a thing. Because yeah, it's important, and we get people smiling and laughing and talking and being comfortable, and that's like more important than conjugating a verb correctly.
All right, excellent. We're about 10 minutes until we need to kind of wrap it up, but do any of my panelists have any final thoughts or anything that they wanted to add before I kind of open it up to other questions or comments from the audience?
If anything, just like final words is just to try. Like Emmy was saying, Mandala, just trying is a monumental feat. because, oh, no, sorry, no hablo español, and that's it, leave it at that. As opposed to, okay, ¿cómo se dice? Is way better because it immediately, that interpersonal communication. And in general, speaking in the stereotypes of the Latin American culture, all the way from Mexico, all the way down to Argentina. It's like our history is from Spain, and therefore we have this common culture of, I have to say, like love. It's a very communal society in general. So just the attempt from someone that you know doesn't speak the language is just like, oh my God, okay, that's it. There's somebody that I can work with. And since the whole purpose is to the little furry clients or the patients, since it's working for them, it's totally worth it just to try. Maybe release a little bit of that ego that we're just like, no, I don't want to sound terrible, but it's fine. So if anything, the last final thought is just to try. It works better than not. Cool. Thank you.
All right, I'm going to share some contact information for LVMA, MCVMA, and Spanish for Vet Pros, so you guys can check everyone out. But if anyone from the audience wants to, share a comment or ask a question, please do. I'll open it up to everyone now.
While we're waiting, I can tell you a funny story that happened to me the other day. I was walking my dogs outside, and like a 9-year-old kid was like speaking to me really fast, and I was like, I can understand you, but not so fast. And then he looked at me, and he's like, "Usted hablar inglés?" And I'm like,
No,
like,
it
just
was
like
usted
that.
hablar gringo.
Yeah, sorry.
Yeah.
Usted
hablar
hablar
gringo?
gringo? And I'm like, what 9-year-old chubby kid on the street? I was like, see. Anyway, ask your questions.
Eddie, you got a question
I feel
in the
honored.
chat. There you go. Do you want me to read it to you?
I got it. I have it up right now. Thank you, though. I appreciate you.
Okay.
It says, question for Eddie. What was your experience teaching the Spanish workshop yourself? Okay, so since LVMA at Cornell was founded, or a little bit after, we started having Spanish workshops that students put on. So we have a Spanish workshop chair, and that person is in charge of creating presentations and just very, very simple content. We have a dialogue that people go through in Spanish. We talk about anatomy of large animals and small animals and stuff like that. So we are kind of trying to push Spanish at a student level. In terms of the experience for the course that we made, it was actually made into a small course at the vet school, and we're hoping to keep it going. It was really a lot of work. It was a lot of work, but it was so, I'm getting goosebumps just talking about it. It's so satisfying to see people really, really try. I wasn't involved in teaching per se. I was involved in like organizing and getting stuff together. And honestly, shout out to Natalia. She's the VP. She was the one that was mainly focused on organizing and creating the course. But it was very satisfying to see people as you rotated through the little groups, see the TAs learning Spanish because they already knew how to speak Spanish, but it's not the same to know that knowing Spanish and teaching Spanish are two completely different things. So it was great to see them go through that process. It was great to see the students really try it out. And just the corrections, like, oh, you would be able to say it this way, or what does this mean in Spanish? Or how do I say this in Spanish? It was a great experience overall. So yeah, that's my answer. If not, I'll just keep talking because it was great. Thanks for asking.
Oh, you have another question.
Oh my God. Are we looking to build a Spanish courses for vet we offer? Eddie, do you have any tips on how you guys did this? So first of all, we're doing this kind of not rudimentarily, but we're doing it like by ourselves, and that's not necessarily the best way to go about it, because usually, it's up to professionals to actually teach the language. But it's a good start. That's what we want to do. We're just starting it off to see if a professor at some point will come along and help us with the process, because they're the ones that actually know. But in terms of how we started it, we just following a book. We're not even making material. We're just following a book. It's I don't recall the name. It's over there, and I don't want to run and get it right now. But it's a book that is free. You can find it online, Google. It's at least the older version, and it's a very excellent resource. It goes through all the basics: how to conjugate a verb, how to say certain animal parts in Spanish, how to like communicate with the client. It even has stuff on like material on exotic animal species. So definitely, we just looked at that book and said, what are the relevant things of this book that we can teach people, help people? That's the one. Thank you. Oh, there we go. Haha. Teamwork makes the dream work, y'all. And that we just followed that book, made a syllabus and a schedule, and then every certain times a week, we would get together and go through a certain amount of chapters, do some exercises, and everything was like led by a TA that actually knew the language. But I'm more than happy to speak about this later, so we can have other questions for other people. But thank you all. I appreciate the enthusiasm.
If I may, really quick, for anybody wanting to develop their own program, it really is setting up the context. It's the situation in which the varied vocabulary kind of jumps in. And if you don't mind, if I can do the share screen, I could show you our content, just to give you an example of what is it that we do and how we do it. Ooh, got it. Share screen. And let's just do the whole shebang. Bam. Google Chrome. Let's just do the whole share. Oh, there it goes. So this is from our first module, just to show like the overview. What we did is divide everything into 10 different hours. So that's first consultation all the way to clinical signs and symptoms, and then going to specifically different anatomy diseases, diagnostic tools. So what that does is it creates an entire like consultation from the beginning. It's like, hello, my name is, how can I help you? All the way to the end to like, this is how much you owe me, and like the basic home care stuff. So it follows that procedure, which looks something like this. Boom, there it goes. So this is our like super chart. And after the initial stuff, okay, ¿por qué nos visitan hoy? Or what's going on with the thing? And tiene diarrea. For how long, the additional questions that you may ask. Okay, let me check these body parts. Let me do these exams. And this is what it possibly could be. So we have like these standardized, what are they, contexts? Which then we're like, okay, in your practice, how does that branch out with the different types of vocabulary? And then with the different types of Spanish that it would be, like we'd focus it on the different nationalities and whatnot. And yeah, that's just a little bit because we just expand on everything. There's talking about the feeding guide and everything, the formula for all that stuff. So it's getting the context in which you want to communicate, and then figuring out from there. And it's always like context driven is the most important thing when it comes to like what it's called a communicative approach, is establishing the situation and then be like, okay, what would you say in English? And let's translate all of it and say it in Spanish. So hopefully that helps out a little bit with the methodology and whatnot, but it is what we do.
Yeah, and I think for veterinary students, a lot of times we see in our classes, like the students will be saying,
excoriation.
yeah,
Why? It's a freaking scratch.
So it might be helpful to have somebody who's like worked in a clinic before or has gone through those actual conversations with clients, so you don't waste time learning, what's Spanish for splenectomy, for example. It's easy, but so you don't have to waste time like learning medical terms that your clients may not understand, so a lot of times we have to remind students, well, like, I don't understand that, so how else could you explain that? That would be another tip.
Okay, everyone, we are at the end, but I need to give a massive thank you to our panelists. I mean, we couldn't have had a better discussion, I think. And this is only the beginning. I think that we can, there's a lot of things that we can do from here. I would love feedback if you can. So maybe what we would do is we'll send out an email with everyone's, because we have contact information from people who signed up. So we can send a follow-up email. I also need to give a special shout out to Dr. Ashley Davis Ferguson. And it's really because she kind of pushed me to make sure that this was done. And so thank you. And I will leave it at here, and just please be on the lookout for a part 2 of this discussion, wherever that might lead us to. Thank you guys so much for attending. I really appreciate it.
Have a good night, everybody.
Thank you,
Good
everyone.
night.
Gracias,
Buenas
buenas
noches.
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 Hasta luego. Keep saving lives.